Okay, so we're back on. So you were saying that you didn't want to be an orthodontist because it didn't suit your personality, and and you went and took Bill Hang's residency, and you saw that all the injuries, lifelong injuries that conventional orthodontic work was causing for people. So you said, I've got to find a way to do this myself, and so I can at least help some people.
Yeah,
And you read this book, and it was a hard thing for you to see.
yeah, exactly. So basically, what happened was, I always say, if you understand, if you believe in the theory, the philosophy, whatever you want to call it, behind, what Biobloc Orthotropics is all about, how you could, I always tell people, you wouldn't send your worst enemy's child to an orthodontist, right? So even though it was something I had no interest, I did, it was the last thing I ever wanted to do. It was like I was compelled to, right? I didn't have a choice because I would never send my kid to an orthodontist. So how can I send anyone else's, right? And it kind of sucked because I'm in this small town, so I've got, there's literally nowhere else I can send them for hundreds of kilometers of radius around Salmon Arm, right? So I decided I got to learn how to do this myself. So I pick up the textbook of contemporary orthodontics, and it's like the Bible of orthodontics, and it's obviously there's a lot of before and after case photos in there of these kids that have supposedly had excellent treatment, right? I mean, you're not going to put your worst stuff in your textbook. It's this guy's best results, and almost all of the after photos, if you look at anything besides the teeth, and you'll soon notice that the kid's head is further forward and it's tipped back and their mouth is open because that's the only way that they can breathe now, right? And and then you get to the even worse part. The later chapters of the book are the complex surgical cases where this problem is so bad we can't even fix it orthodontically. Now you've got to have orthodontics and jaw surgery, and then they talk about all the these issues with recession of the lower front teeth, which they blame on the surgery, which I think is actually caused by something else. But there's just a whole bunch of it just goes on and on and on, right? I mean, you get your orthodontics, then you get your jaw surgery, then you get your gum grafts, then you just have constant problems for the rest of your life, all of which are 100% preventable if you would have seen John Mew when you were 6 years old, right? Or anybody else that actually knows what they're doing that actually addresses the cause instead of the symptoms.
Can I be a bit diplomatic here for a sec?
Sure.
It's really fake. I mean, but not all orthodontists practice conventional, right? Some orthodontists practice a more holistic approach and are more cognizant of the airway and
Yeah, I think so. It's tough because that's one of the issues that's so bizarre, right? Is there's all these different kind of dogmas or whatever you want to call it, and so I think that, and I've been to a few different courses with some lecturers that they think they're doing the same thing as John Mew, but I don't think that they are. I still don't think they actually understand what John Mew is doing, right? So, I mean, I guess they're less bad, if you want to call it that.
okay.
I know there are a lot of people that are, you know, anti-extraction, for example, right? Like they won't pull out permanent teeth except wisdom teeth. So, they'll do some expansion, they'll do whatever they got to do to at least get 28 teeth to fit in your mouth. But as far as I know, a lot of them still use elastics or different types of mechanics to try to correct overbite overjet problems, right? I mean, you can't fix that without surgery unless you're going to somehow drag the maxilla down and back and create a headgear effect, right? So, yeah, it's everyone kind of seems like because then you've got the whole issue of, BioBlock is really difficult, right? It's difficult for the practitioner, it's difficult for the child, it's difficult for the parents, and so that not everyone's cut out for that, especially
Yeah.
in society in the world we live in now, especially in North America, right?
Okay. But there are alternatives to conventional orthodontics.
Yeah, oh, yeah, for sure. I mean, yeah, I mean,
Could you name off a few? Could you name off a few things that people could look up that will not drag the upper jaw down and back?
Well, like I said, I'm not, as far as I know, the only thing that is not going to drag the upper jaw down and back is Biobloc Orthotropics, right? I mean, even some of the people that do like Damon Ortho or whatever, like I said, I don't know too much about that, but what I've heard from other people and different things I've seen, it seems like they still do the class 2 elastics, right? Um, which is just an elastics between the upper and lower jaws to they think they're just making your teeth move to fit, but you can't, no matter what, if you anchor your upper and lower jaws together with an elastic force, it's going to create a headgear effect, right?
Okay. What about the ALF or the Myo brace or um,
Yeah, again, those are things I'm not as familiar with.
okay.
I don't know what is all involved in that. I think the Myo brace, um, even the BioBlock. I mean, even the BioBlock can create a headgear effect if you don't use it properly, right?
Okay.
So I've heard some people criticize the Myo brace as though it creates a headgear effect, and other people say, well, it's really a training tool, and if it's used improperly, whatever, right? So yeah, I don't.
Yes.
I'm not the guy to comment on those things because I don't know enough about them.
Okay.
Um,
So,
'Cause-
may I interrupt you for a sec? I'm thinking parents right now are thinking, well, what do I do? Where do I send my kid? Because it more seems like it's not necessarily the technique, but it's the actual practitioner and the skill of the practitioner makes a huge difference. Um, so, could we tell parents that if anything, if you don't have a skilled practitioner in your area, the best thing you can do is to make sure your kid is breathing through their nose with their mouth shut and their tongue up on the roof of the mouth?
yeah, absolutely. See, that's an incredibly good point because this is kind of I've got my own little plans for changing the system, right? Where I want to shoot some videos and try to educate parents. And what I say to people is the problem we've got now is there are millions of children getting their lives ruined by orthodontists, right? But there are an incredibly small handful of people that actually understand Biobloc Orthotropics, and there's even fewer that are actually doing it, and et cetera, right? So if we succeed in educating people, so now you've got millions of parents looking to get their child treated with Biobloc Orthotropics. Now you have a really enormous supply and demand problem because there's just no one to provide that treatment.
Yeah,
But I consider that to be a better problem than the problem we've got right now, right?
right.
And I think that's how the system is going to change. So what I say to people is doing nothing is better than doing the wrong thing, right?
Yes.
So I mean, if you're somewhere where you're like, okay, crap, I really want to get this treatment for my kid. There's nobody within 100 miles of my, it's just not feasible. I can't fly to LA and see Bill Hang, or, where if you're in a different part of the world, you can't make it to see John Mew or Simon or whoever. Um, then yeah, like you said, just try to make them eat a harder diet. I mean, one thing that I don't know if you know about this yet. I'm not sure if this was Simon or Sandra that put this together. They maybe did it together, but there's a website called gopex.org,
Okay.
and GoPex stands for Good Oral Posture Exercises. And they've got a book and everything. I think it's available now. You can order it, and there's actually a ton of stuff just on the site. Like they just give you the exercises on there and stuff. There are things you can do to improve your oral posture, which are going to, be better than doing nothing. I think it's a little tough. I mean, if your upper jaw is too narrow, too far down, too far back, it's going to be really hard to learn how to keep your tongue up there. I think in an ideal world, you'd at least be able to see somebody do some expansion and a little bit of advancement of your front teeth, but how easy that's going to be to find, I'm not sure.
Mm.
But yeah, I think, and then the other thing too is, like I said, there are all these kind of adjunctive things that tie in with this whole thing where, there's I never know whether it's technically considered a treatment or not, but there's something called Buteyko breathing.
Yeah.
I have several books by a guy named Patrick McEwen, and because it's, again, it's what he makes a pretty compelling argument that it's not just the size of your airway that is important; it's the fact that we actually chronically hyperventilate, right? When your mouth is hanging open and when you're constantly under stress and you live in our society, we're just our breathing volume is too much. and our breathing is too shallow and too fast, and there's a whole bunch of issues with the way we breathe. So yeah, I think if you can figure out what to eat, if you can learn how to keep your mouth closed, if you can breathe through your nose in the appropriate volume, if you can learn how to sit, stand, walk, bend over, and lie down properly, those things are all going to help, right?
Okay.
Your teeth might be crooked if you're not going to get that fixed, but yeah, it's going to be tough. It's going to that's going to be a problem, right? I mean, if
Yeah.
you succeed in what you're trying to do, and if I succeed in what I'm trying to do, which we're doing the same thing, we're going to create a pretty massive supply and demand problem, and
Oy.
that's just there's nothing you can do about that, right?
Yeah, yeah. One of the papers that we have on the website is from the early 1900s, and the writer, who was an orthodontist, he says he looks at the faces before and after of kids who had retraction on the upper jaw, and this paper is going back, around 100 years,
Yeah.
and he says his conclusion is that orthodontists should stick to just moving teeth, but not moving bone. Because basically he's alerting us, right, that this industry is not qualified to understand the ramifications on changing the skeleton,
Hmm.
changing the facial skeleton, ramifications on airway. What about blood flow? If you make the skull smaller than it's supposed to be, are we impacting blood flow pathways?
Yeah, who knows? Like I said, I mean, that's stuff that I don't know anything about.
Yeah.
I know, yeah, I'm not even gonna. I know a guy that has a theory that part of the reason people go bald is because of he thinks there's an artery that actually runs through your TMJ and supplies your scalp. And so if you've got issues with class 2 jaw relation mechanics, that's going to cause baldness.
Interesting.
Whether that's true or not, I have no idea. Because he claims there's a separate artery that supplies the kind of the back where, people typically don't lose that hair ever. So,
Mm.
but yeah, as far as any other, blood supply in or out of your skull, I have no idea.
Yeah. Okay. Well, now what about fixed retainers, Hawley retainers, upper and lower? A kid wears this to sleep when their face is trying to widen, which will obviously change the position of the teeth the orthodontist put them in. Are Hawley retainers another growth stunting appliance?
Well, again, I don't know enough about that to really comment on that. I know, I think that because, like I said before, I mean, orthodontists do some expansion, right? So I'm not sure, but I think the reason you're wearing the retainer is because they don't want that expansion to relapse.
Okay.
And I know there's been some posts on that. I'm part of this Hang group forum with Bill Hang's group, and people have asked about that and said, we're making these kids wear these retainers, and the response was kind of, well, yeah, but part of your treatment was you made their upper jaw massively bigger than it was before, right? So now you're retaining this much larger size
Yeah.
and not letting it relapse back down. Again, though, if you listen to John Mew, in an ideal world, your tongue is the retainer, right?
Yeah.
Your tongue is supposed to be in the upper jaw. So, I mean, but that's not even on the orthodontist radar. I mean, that's not even a consideration in the treatment that they're doing, right?
Okay.
So, yeah, because I don't know. I mean, if you take a kid that has orthodontics, get some expansion done, does nothing to correct their posture, and then if they wear a retainer, if they don't wear a retainer, what's going to happen? I don't know. I mean, because like I say, it's possible that their upper jaw would actually get smaller without the retainer
Okay.
if they don't have the tongue in there, right? But
Now, what about a kid who didn't have expansion? Like, I know kids who have first phase of treatment is a headgear, which pulls the upper jaw back. And then second phase is braces to just keep the teeth straight. And then the third phase is a retainer when they're, say, 15 and still growing. So there's been no expansion.
yeah, that's got to be bad. I mean, and again, I mean, I've seen people where because again, what happens is if you've pulled everything back, right, and now you're here, and now you're going here, and you're making everything worse. Depending on what happens after that, if you end up hanging your mouth open all the time, versus some people end up clenching and grinding and things because of their airway problems and stuff. I've seen some people do some pretty serious damage to their teeth, right? Because their lower jaw wants to be further forward, but these upper teeth are here. And so it puts a lot of force on the teeth. Like, there's people where you get them to tap up and down, like open and close, and you can feel these upper front teeth moving. And they've got issues with the recession and notching in the teeth, or they wear them down.
Okay.
And so yeah, I mean, anytime you move teeth somewhere where they don't belong and then hold them there, you're going to cause problems, right?
Okay. Next question I have for you. There's a paper, again, early 1900s or maybe mid, by a lady named Bjork. Last name was Bjork. And she's an orthodontist. And she says that kids naturally tend to be class 2. Babies are born with a smaller mandible. And so if you look at a 5-year-old or a 6-year-old, they're not going to have the same maxillomandibular relationship as a 14, 15-year-old or a 20-year-old. In other words, kids are naturally buck-toothed. And what she said is it tends to correct over time. The lower jaw comes out later on in life. So are orthodontists completely ignoring natural growth patterns when they look at someone who's, say, 11 or 12 or even younger and say, oh, yeah, you have your upper jaw is too far forward and your lower jaw will never catch up naturally?
Yeah, that again, like I said, I'm not 100% sure at what point, you should expect a normal jaw relationship.
Okay.
Because it kind of seems to me, yeah, again, I think it depends on, if you suck your thumb and you use a soother and you've got allergies and you're a mouth breather, I don't think that's ever catching up.
Okay.
I'm not sure, but I don't think so.
Yeah.
Because even with my own children, right? My 5-year-old daughter, I actually did a little bit of expansion and a little, kind of nudged her baby teeth forward a little bit, and it didn't take long before she doesn't have that overjet anymore. Whereas my son's got bigger issues and he does have some overjet, and I'm just starting to treat him. And we'll see how it goes. I'll let you know whether I think once I widen his upper jaw and move his upper front teeth forward, and we get him doing these Gopex exercises, I don't think it's going to take very long before he does. The lower jaw catches up, right?
Okay.
I think if you have your mouth closed all the time, both jaws grow forward together. That's my understanding of kind of the philosophy behind Biobloc Orthotropics.
Yeah.
When your jaws are together, they grow forward together. When your lower jaw is hanging open, they tend to grow apart, right? It's divergent growth, I guess they call it.
Okay. So what's one major takeaway for parents? The one thing that they should just not do, the one thing that they should watch out for, and the one thing they should absolutely do.
Well, I think the thing is you don't want to do anything that's going to make anything worse, right? So if you're, obviously, I don't even know why headgear still exists. Like, I don't think it's used very much anymore. Like, I think you're really a dinosaur if you're using headgear. I'm not sure about that, though. I mean, I don't know what your experience has been with the other people you've talked to, but, a lot of people say, oh, yeah, headgear, that's archaic. That's not, that's so far in the past. And but there's still a ton of permanent premolars being removed, right? I've got a patient in my office that they went to see an orthodontist in Vernon, and it's a long story how this went, but eventually he ended up recommending that they go see the oral surgeon to get the two upper permanent first bicuspids removed. And then he wanted them to remove, she still had baby teeth on the bottom, and he wanted them to pull out those baby teeth and the unerupted adult teeth, right? It's called enucleating the tooth bud or whatever, which I had never even heard of that until I took Bill's course. And I never thought I would ever see it in real life. And so I ended up shutting that down. Like I talked to the parents and I treated her myself and didn't pull out any of her teeth. But I think, yeah, I mean, obviously the things to avoid are extractions and retractive headgears. And like I said, even the things that are little, the class 2 elastics and the different types of functional appliances that are designed to theoretically grow the lower jaw, but what they're really doing is causing a headgear effect and dragging the upper jaw back.
Okay.
Um,
So so then in layman's terms, the one thing you should never do is pull the upper jaw back, and ideally don't pull teeth back.
yeah.
Don't pull back.
Yeah,
And so
anything going back is wrong. Just period, right? I mean, there are
yeah,
no
yeah,
circumstances where backwards is acceptable.
exactly. And that means even elastics that try and use the upper jaw to pull the lower jaw forward. So, so people, I'm just talking to the parents now. So what will happen is like there's called intermaxillary elastics,
Sure. Yeah, I mean, there's different terms, right?
different
But
terms, but basically they'll take elastics um, that pull they anchor to the upper jaw, and they pull the lower jaw forward. But by pulling the lower jaw forward, you're also pulling the upper jaw back. So even elastics that do that pull the upper jaw back, which again, a no-no, absolute no-no.
well, and then again, I'm not super familiar with Invisalign, but I think a lot of Invisalign treatment is carried out with what they call interproximal reduction, where they shave your teeth smaller. Because one of the main, a hugely common problem people have is that their lower incisors are a little bit crowded.
Okay.
That's kind of the chief, like older, like adults, right? Like young adults and even, middle-aged 40s, 50s, especially people that already had braces, but then they never wore the retainers and stuff, right? So they'll come in saying, "Oh yeah, I've just got this one lower tooth that's kind of crooked down here. Like, is there a quick fix for that?" And it's like, well, no, because you're like this, right? You have no overjet, and so if you're going to try to unravel those teeth, they're going to want to dump forward, and your upper teeth are in the way. Like it's a comprehensive problem, right? It's not, and so, but you can go for Invisalign, where you just shave all your teeth down and make them smaller so they can fit in there. Or something worse, you pull one of them out and just have three lower incisors down there, three, and so those are the kind of things that, yeah, I mean, like I said, anything that is making your mouth smaller, your oral volume is going to be decreased, is bad. I mean, there's no way to justify doing that, I don't think.
Okay. So that's the one thing they should not do. What's the one thing they should watch out for?
In what sense? Like,
Like their kids' posture, their kids' breathing habits, or
well, there's a whole bunch of signs, right? I mean, if you, um, yeah, I mean, it all depends. There's like allergic shiners, like a lot of kids you look at now, they've got dark pooling under their eyes. Um, your They call it the allergic salute, where you go like this, like they're constantly rubbing their nose because it's running all the time. I mean, just your mouth hanging open, right? Just like look around at kids. It's funny. My daughter's in kindergarten, right? And outside of her classroom, there's a wall with a bunch of photos of all the kids. And I mean, these are 5-year-olds.
yeah,
And you look at these kids, and it's most of them have absolutely no spacing between their baby teeth. They've got cross bites. They've got gummy smiles. They've got worn down teeth. They've got a lot of issues, and they're obvious, right? So, but again, it's going to depend on what their actual habits are and what their posture is. But Some kids have what Bill Hang calls bozo lips, like they lick their lips all the time, and so it's all red and crusty around the outside of their lips.
Yes, I've seen
Some
that.
kids have, they call it an accentuated Cupid's bow, so the upper lip, because your mouth's always open, the corners of your mouth are pulled down, and so your upper lip is a lot more curved. Um, so there's just a whole bunch of things, but and then there's the whole behavior side. Like, is this kid really tired all the time, or are they hyper all the time? Do they have ADD symptoms? They have problems in school. Do they wet the bed? Do they have a bunch of chronic ear infections? Those things are all kind of related, right? So,
Okay, okay. But is the main thing, if a kid is mouth breathing, that's a problem?
yeah, absolutely.
That's the major
If you
problem?
can hear, if you can hear, like my son, I'm like, close your mouth because you can hear the kid breathing, right? Like a human being that's breathing properly, you shouldn't be able to hear that. That should be silent,
Okay.
and especially in kids. And it's another thing too is children are not supposed to snore, right? I mean, if you've got a 2, 3, 4 year old that's snoring, that's a problem. That's a big, huge problem.
Okay, okay, okay. And snoring is breathing through the mouth,
Yeah.
and then the tongue
Huge.
falls back.
Yeah.
Yeah, okay.
I
So,
think I think it
so
is possible to snore through your nose somewhat, but yeah, typically, yeah, that's sleeping with your mouth open. Is you're snoring or not, right?
yeah,
Like, how many photos do you see on Facebook every day of a kid sleeping in a car seat? Like,
yeah.
you know,
Okay, so the number one thing parents should watch out for, would you say, is to just to make sure that their kid is breathing through their nose with their mouth shut and the tongue up on the roof.
yeah, there's different ways to do that. You can get them to hold a little bread clip between their lips, just gently, and just walk around like that with your mouth closed.
Okay, okay.
There's little
Um,
some tricks too.
and then what's the one thing that they absolutely must do for their kid?
Well, I think the number one thing you can do, like I said, is go check out gopex.org.
Okay,
And there's 6 or 7 very simple exercises on there.
yeah,
I mean, it'll take probably 20 minutes a day to do them, and just do those. Right?
okay. What about eating tough foods early on in order to build the jaws and to build the bone and build the face so that it fits the tongue so the tongue can be forward so the kid can breathe properly.
Yeah, that's what I like. I'm always running around saying I don't understand what a human being is supposed to eat. Like, I don't know what, I when I was in Chicago, John Flutter was there, and I think he's from Australia. Do you know him?
No.
So he talked about going to some remote island somewhere. I can't remember the name of the place where the locals, the indigenous people that were on the island, they had all had much better facial development, and you never make a living as an orthodontist there. And he said they fed him whatever their local. I think it was some kind of vegetable. I'm not even sure, but he said it was so tough that he could just barely chew it. And that's what they eat. Like, that's their diet, right? And so for us in North America, particularly, like, craft dinner and chicken nuggets, and you know our diet is just not. They're just soft. They're just you barely have to chew them. You practically swallow it whole, and
Okay.
we just don't chew enough. So yeah, like I talked to Mike Mew about what I should do for my kids, and he said just get them to chew really hard gum for an hour a day.
Mm-hmm.
But I don't know what kind of gum you're looking for there. Like, I gotta talk to him more about that and see, because I've seen different posts online about these gums that you order from like Greece or something. You gotta order them from Amazon, and
Yeah.
they've got a tree sap and stuff. Like, I don't know what kind of gum you're gonna buy in Salmon Arm that you can. It's gonna be hard enough that they have to really put some effort into chewing it. Right?
Mm-hmm. Mm-hmm. Okay. Okay. So,
But yeah, I think you really gotta find a. Like I said, I don't know what kind of a hard diet you're supposed to be eating, and if you can't do that, then yeah, I think the best thing to do is find some really hard gum and just have them. Because like I said, Mike said it's just a matter of 1 hour a day with your mouth closed, right?
yeah. Okay.
Uh, chew some hard gum and keep your mouth closed.
Rob, if a politician is watching, what would you say to the question of should we ban the use of orthodontic growth stunting through headgears or other appliances that make the mouth and the skull smaller than it is genetically intended to be? Should we ban these?
Absolutely. Like I said, I mean, I think at this stage of the game, it's like criminal that you've got this kind of crap going on in the world. Like,
Okay.
I don't understand the. It's interesting when you ask the question, why hasn't it changed, right? Like, why are orthodontists still doing this stuff? Because there's a TED talk that I watched. I can't remember if it's about being right or being wrong, but those are two sides of the same coin, right? So what this woman basically says, I think her name is Catherine Schultz, but I'm not sure about that. But what she basically says is a lot of people you learn at an early age that you don't want to be wrong, right? Because if you're wrong, you're a loser. And so you develop this obsession with being right about everything. But that's a problem when you find people that don't agree with you, because then they've got to be wrong, right? So you've got to explain that somehow. So what she says is we all kind of do that the same three ways. We start off by saying they're ignorant. They just don't know. They just don't have the information, right? If you had the same information that I have, you'd make the same conclusion that I've made. But if it turns out they do have that same information, then they're just stupid. Because, if you had half a brain, you'd obviously agree with me, right? But if they have the information and they're halfway intelligent, then they're evil. Because they know better, but they're just deliberately doing wrong for their own malevolent gains, right?
Mm-hmm.
So I don't even honestly know. Like that's part of the, I kind of feel like part of the issue is built into our education system. There's a selection for like a certain type of person is going to become a dentist or a doctor or an orthodontist. Because in order to become that, you have to do really well in school. And the way the system is set up, a certain type of person is going to do well there.
Right.
And so I'm not sure. Like I said, I don't understand why it hasn't just evolved and changed on its own. But seeing as how that hasn't happened, it'd be nice if some outside force could step in and say, this is no longer allowed, right?
Yeah. Okay. Anything else you want to? Anything? Pardon me?
I said, does that make sense?
Yes, absolutely. Absolutely. That's the whole point here is to ban this, so it never happens to anyone again.
That into something you can use or not.
Pardon me?
So I don't know if you'll be able to edit that into something you can use or not.
I could use it perfectly as it is. Any last things you want to tell to parents? Or a child watching, or like a teenager watching, a 12-year-old watching.
Yeah, I think, a couple of years ago, I was introduced to a guy named Jim Rohn, who was like an old school motivational speaker, personal development trainer, business philosopher. And one of the things I really like that he always says is he says, don't be a follower, be a student. So he's like, don't take my word for it. Don't listen to me. Do your own, think for yourself, right?
Yeah.
Listen to me, listen to some other people, make your own conclusions. And so I think that's so important, but so difficult today is for patients and parents to try to make an informed decision, right? Because you hope that any parent out there is going to try to do the best for their child, right? But there's just so like Bill Hang has so many stories of mothers that have taken their kids to the head of the orthodontics at Harvard or Stanford or whatever, right? Like just trying to get the absolute best possible treatment and end up getting some of the worst possible treatment. And so it's just such a difficult environment today for like I always say, this should be the best time in history to be a patient with a problem, right? You should have access to the best care that human beings have ever had access to, but you don't. right? Like it's a broken system based on an obsolete model. And so I think it's just absolutely critical for parents just to really think about whether or not the recommendations make sense, right? Recently on the Hang Group forum, somebody asked a question of, can someone give me some pointers or some things that I should emphasize to justify why I'm advising this parent not to have these teeth extracted on their child. And Bill wrote back and said, at the end of the day, he said, I've been thinking about this all day and it's really bothered me because we're always the one in this position where we've got to justify what we're saying. Why don't you ask that patient to go to the orthodontist and ask them to justify their recommendation for removing the teeth? Flip that around and say, you show me some rationale, some evidence. Like, I think the whole concept of evidence-based medicine or evidence-based dentistry is basically a joke at this point. I mean, you've got some pretty good, I mean, there is stuff out there, right? But there's so much evidence and research and articles that are published that are just, it's not even worth reading them. Like, they're so far off base, and the conclusions they draw are so ridiculous that it's crazy, right? So I think that, yeah, I don't know, I'm like just rambling and not answering the questions here, but I think that like I said before, doing nothing is better than doing the wrong thing, right? So make sure you really understand the choice you're making and why you're making it.
Okay.
And make sure that it makes sense to you, right? Because it's, to me, all this stuff that orthodontists are doing just makes no sense, right? I mean, it's just like it's intuitively obvious that you shouldn't do that.
Yeah.
And I think the good news, which is also the bad news, but the good news is, this orthodontics has been around long enough now that most people my age that are parents with young children probably had it when they were kids, if their parents could afford it, right?
Yeah.
And so it should be even more obvious because, I mean, if you're a victim yourself, you just have to look in the mirror and you can see what happened, right? What the outcome of that was. So it's pretty obvious you don't want that for your kid.
Mm-hmm, mm-hmm. Cool. That helps. Yeah, I really appreciate that, and I'm sure the parents watching will hopefully change direction if they've already started orthodontic treatment that's conventional in nature or attractive in nature. And thank you very much for your time.
Hopefully that's helpful.